Hello, Namaste. I welcome you all to this online session with Dr. M.B. Gururaja sir. This is Gurubodha session 13. I cordially welcome Dr. M.B. Gururaja sir to this class.
Thank you, Dr. Janardhan.
Thank you, sir. I welcome you all to this class. Dr. M.B. Gururaja sir, he is an Ayurveda practitioner with more than 20 years of experience, and he is also professor in an Ayurveda college. His Ayurveda center is Gavala Pentacare Ayurveda Treatment Center, which is there in Shimoga, Karnataka, South India. And this session is exclusively held for our weekly online class webinar subscribers for the live interaction. So the herb that we are going to discuss that Dr. M.B. Goraja sir is going to teach us all is a very interesting herb. It's called as Katuki, or it's also called as Kutki, available worldwide, and one of the powerful herbs of Ayurveda. So these are a few photos of it. Starting from cholesterol, a lot of diseases, it is useful. So Gururaja sir, please enlighten us regarding this wonderful herb of Kutki.
Definitely. Thank you, Janardhan. This is one of the important and very versatile drug of Ayurveda. And we do come across a lot of occasions where Katuki is a very important one. And even though it is having a Tiktarasa, and that is a bitter principle, and it is a Katuvipaka, Ruksha Dravya, and Sheeta veerya Yukta, but most of its actions are concentrated around its Tiktarasa, that is a bitter principle, which is very in its action and penetrative in its action, and its effect on liver, it's very wonderful. And of course, its effect is also seen on the colon. So it is definitely one of the important mala bhedana dravya, means it tries to evacuate or clears the bowels in a very systematic manner. Whatever may be the type of the stools, it may be it is digested, undigested, or whatever it is. All sorts of stool will be evacuated from the bowel by stimulating the liver. It also stimulates the liver in such a manner it excessively produces the bile secretion. So it stimulates the bile channels to open up. So that's the reason it is being extensively used in particularly the gallbladder stones or cholelithiasis condition, as well as all sorts of liver involved viral diseases or hepatitis, or maybe due to any other reasons hepatitis is there. In those conditions, in order to reduce the swelling of the liver, we use this Katuki extensively, and it is also useful as one of the important immunomodulator or immunobooster. And of course, for many liver disorders associated with that, with fevers. So there may be some fevers associated with that, like hepatitis also do have sometimes associated with the fever. In those conditions, as well as even general fevers, we can use Katuki. And it's one of the versatile drug and wonderful drug. It has got a lot of action on particularly the liver, as well as gallbladder and colon. So these are the areas we need to when we are using this drug, and it has its very what you call a versatile action on particularly on liver. It enhances the bile flow, it enhances the even the glucose metabolism, it improves all sorts of functions of the liver, and it also avoids the damages to the hepatocytes. So it's one of the wonderful drug at our disposal.
There is this always a confusion that it is named as Katuki, very resonating with the pungent taste, but it's called as Sheeta veerya herb. It is very frequently used, like you said, in a lot of disorders. Like in which particular liver conditions can it be used, sir?
Even though this Katuki, the name is Katuka Rohini, or these names are there, maybe depicting or sounding or mimicking towards it's a pungent drug, but it is not the pungent drug, it is a bitter drug. It is a highly bitter drug, and this Katuki definitely has a role in liver disorders. We use Katuki in, you observe that Katuki, that's the reason for every disease of liver, we use Arogyavardhini as one of the important yoga. And this Arogyavardhini contains 50% Katuki. one of the indication which suggests that very clearly the where it is extensively used and what is the reason for that. Arogyavardhini is one of the universal liver medicine, and it is used extensively across all liver disorders. It may be alcoholic-induced hepatitis, it may be viral hepatitis, or it may be cryptogenic liver cirrhosis, or it may be any sort of all sorts of liver conditions where there is a liver cell damage and there is a cholithiasis, gallbladder sludge. In all those conditions, Katuki is one of the important drug for us to use it. Of course, even if we mix these things with the Kshara, according the blockage or obstructive nature of jaundice or something like that, it is there, or obstructive or which is called as Vruddhapatha Kamala in Ayurveda. So that type of diseases can also be, we can use this Katuki. But here in Dravya Guna or in Ayurveda, wherever Rasa Guna Veerya Vipaka of a Dravya has been explained, generalized veerya has been quoted. So for example, in this case, Katuki, the generalized veerya of this drug is Sheeta. It doesn't mean that Sheeta veerya will influence on all the other aspects of the drug and its activities. No, it is not like that. It is only a general perception and a general observation and then the consideration that it is a Sheeta veerya dravya. But what is veerya? Veerya means this is the one which has the potency to work in a particular direction, or yena kurvanti tat veeryam, which can be manifested or produced is veerya. So every drug has lot of action brought about by them, but we all know that all these actions are not just because of the veerya, but it is some actions are due to its rasa, some actions are due to its veerya, some actions are due to its guna, some actions are due to its vipaka, like that. So every component of the drug has its effect or influence in bringing out the wholesome activity of the drug. So it doesn't mean that if you think in that direction that it is a Sheeta Veerya Dravya, it should not stimulate the Pitta. No, it is not like that. Tikta Rasa has specifically stimulates the liver and acts as a Pitta Shamaka Dravya. And of course, in Pitta Shamaka, in that sense that it stimulates the Pitta to do its function normally. So that's the way it functions. So it has to be accepted, understood in that sense. So here it doesn't mean that if it is a Sheeta Veerya Dravya, it should not be given in Kasa, Shvasa, something like that. No, it is not like that. It can be used even in that condition where it's Tikta Rasa and Katu Vipaka will take the leading role. And when such actions are type of Rasa of the Dravya, the Veerya of the Dravya doesn't come in the way to stop those functions. That is the beauty of Ayurveda. Not every action of the drug is contributed to a particular type of component of the dravya, and when someone is performing and some is able to produce an action, that action will not be hindered by the other component of the dravya. So that is the thing. That's what they when drug as a whole is given, still it could able to produce a synergetic action, or in a collective manner it functions without hampering its other actions. That is the beauty of Ayurveda.
Regarding its Sheeta Virya, can it be understood that at least it would not cause any sort of burning sensation, as in case of like if you take regular spice, it would cause burning sensation. So it would not cause any such pitta aggravating symptoms in the body, and so that can be understood with Katuki, sir?
No, it is not like that. So when pitta has been made to function in its normal direction, you see, it is stimulating the Pachaka Agni, and it is making the body to produce a pitta in a normal direction, and pitta is facilitated to do its Agni Karma. So when these things have been done naturally without any obstruction to that pathway, then definitely it will not going to increase the pitta in any way. Even though the production of pitta is more, it will be thrown out of the system through the colon. So that is the reason we find very good improvement in the liver functions when these, particularly that Katuki is used.
Yes, sir. And Pradeepaji asks, how can we choose between Bhumyamalaki and Katuki in case of, say, viral hepatitis? How are the indications different, or can they be used together as well?
My suggestion is it can be used together. The reason is, even we have Guduchi, it is also antiviral, particularly with respect to liver. We have Bhumyamalaki. It's a known and established antiviral with respect to liver viruses, as well as even the Revandachini. It is also called as Rheumemodi. That is also one of the drug which can also be used along with these type of things. So Katuki is also another one. So all these combinations are antiviral. So they can be combinedly used, or you can use it as a combinations even alone. So it doesn't make any untoward effect while selecting these drugs if the combination is taken. No, no such things are happening, which is supportive, and it is doing in a synergetic manner, and it is collaboratively the drug is that yoga is giving the result. So we can use that Rememodi as well as Katuki, Guduchi, and even that can be used.
Coming to its Bhedana action, Sarangara Samhita, while defining the Bhedana action, he clearly gives an example of Katuki only. And so Bhedana action can be roughly translated into, say, a laxative or purgative action. So if you compare say in modern terms, laxative or purgative action, so we have other herbs such as Haritaki, Trivrat, castor oil, Croton tiglium, or we have Jayapala. So compared to these, where would Kutki stand, sir?
Katuki is definitely, we can take it as a very good bowel cleanser. We cannot take it, keep it this thing in any other way. See, very clearly Sharandara has said Haritaki as Anulomana, whereas Katuki as Bedhana, then Trivrit as Sukha Virechana, whereas Jayapala as Tivra Virechana. One is a mild and regular purgative, or you can take it as a time being a laxative, whereas but Trivrit Acharya says that it's a Sukha Virechaka. Sukha Virechaka should not cause any disturbance, and it should give out very clearly the Virechana effect. But we do remember and we do use particularly Trivrit Lehya for giving Virechana purposes. So it does Virechana in Vegas will come. It is not only simply Sukha Virechika. If it is given in a overdose, it may even produce a very good purgation. But when compared to the dosage pattern and the result outcome, particularly the Jayapala, which is a very stronger one compared among all these four. Haritaki is a milder form, and it is Anulomana, which can be taken regularly, but of course also causes watery motions many a times. But Katuki is one drug which is can be used in all conditions, whether it is a Baddhamala or Abaddhamala or whatever it may be, Amayuga or Niramamala, all these conditions, it will clear the bowels. So that's the reason Katuki is one of the important drug. It can be taken on a daily basis also in a small doses, just like Haritaki. Because Haritaki is also, it is Pathyanam. Haritaki is very good for the Patha or the Srotasas inside the body. Whereas Trivrit is usually a Sukhaviraj in Acharyas, but it is usually, generally we use them in particularly where there is a planned Virechana procedures are done. In those conditions, Trivrit Leha is used. We don't use Trivrit on a daily routine basis. Similarly, the drastic purgations are very, very required, like in ascites and such type of Jatodakavastha, where there is a free fluid in the abdomen or peritoneal cavity, then we need to go for a drastic virechana type of things, or where there is a Shotha, and such conditions, we use Croton tiglium, that is Jayapal, the more stronger one. So in that order, Haritaki is a milder form, Katuki is in the somewhat same nearer to that. Next is what do you call Trivrat, and the last one is the drastic one is Jayapala, stronger one.
Thank you there. So does use of Katuki for the Bhedana or the laxative purgative effect, does it cause any twitching effect on the intestines and a little bit abdominal pain?
Usually we don't come across, but of course in some Purusha, if it is there, then there may be chances of that gripping type of pain may occur. But generally we don't come across such type of problems. But occasionally if it is a Sukumara Purusha, then there may be chances.
Yeah. What could be the dose for it to be used, say, for mild Virechana purpose and for, for the normal dosha shamana purpose?
See, it's usually within 1 gram. For the general routine purposes, we use it where our intention is to have a stronger bowel evacuation. And if the person's costa is a kurroa costa, then in that condition, we will go for up to 3 grams. 3 grams of Katuki churna, we will take it.
So it is not like any other like very safer herbs where we usually use it for like usually general dose of churnas is kept as like 3 to 5 grams, wherein it is used in a lesser dose.
Yes, definitely. Definitely it should be lesser dose and a longer duration. That gives a very wonderful results.
Next is like comparing this Kutki with Guduchi. Both are like bitter. Both are used maybe for skin disease, for fever for sure. Kapha Pitta Hara action is also seen. So only thing that I see missing in Kutuki when compared to Guduchi, prameha or diabetes, urinary tract disorders, all those things are quite common. Only thing that I miss is the Rasayana effect, which is quite pronouncedly seen in Guduchi, but Kutuki sort of lacks that, sir.
The reason may be because of its generalized veerya. In case of Guduchi, even though this almost similar combination is there, but its veerya is Ushna veerya there. Whereas in case of Katuki, it is a Sheeta veerya. Maybe that combination is not supporting the Katuki to go for that. But on a longer run, even Katuki doing a good liver definitely helps in assimilation, absorption of the nutrients, and it also helps indirectly to act as a rasayana dravya, but it may not be as such of guduchi or even ashwagandha or something like that.
Deepji asks, for how many days it can be given for liver purification or cleansing, meaning for mrudu virechana or nitya virechana, how long can it be given?
See, usually there is a two approach in that. The one is very doing any laboratory investigations or anything, straight away using the drug for the purpose, and the patient will give you feedback continuously. When you use it for maybe 1 week or 10 days, something like that, then the patient will say that I am now regularly passing my bowels are very clean and clear nowadays, and it is with a normal yellow color and everything, whatever the things he will communicate. That is the one method of doing it. The second other method is, before starting those things, if you are feeling that there is a sluggish liver or anything like that, if you want to establish it, go for an electrolyte function test and establish whether there is any sluggishness or any damages in the form of SGOT, SGPT, or even bilirubin levels and all those things. Accordingly, then later use the drug, then once again repeat the test, then the comparison of the two results will definitely give us a very good idea and a clear opinion about how it functions. So it doesn't mean that in every patient it should be taken for such a number of days or something like that. It can be variable from person to person and condition to condition. So it may be for a younger chap with some is very mild to moderate nature, maybe for 10 days things will be settled down. Maybe for drastic and comparatively morbid disease with much of doshas involved in it, then it may take for months together. So it doesn't make any compulsion that we need to go for only for certain days it should be used. No such criteria. It can be used according to the need.
Yeah, Pradeepaji asks, is there any like non-rasa, because in Western countries the rasa aushadhis are not allowed. So is there any non-rasa equivalent to Arogyavardhini, because heavy metal usage is restricted in the US? Probably Patola Katurohinadi comes close, sir?
Yeah, definitely. Patola Katurohinadi comes close to that. But it is our duty to show to the West that how that nanomedicines and these molecules in such a small thing, even though it is heavy metal, it is subjected for purification, and its effect on the body is comparatively different than the elemental metal of the maybe it may be parada, that is mercury or lead or even arsenic or whatever it is. That has to be established, and they should, of course, in due time they will definitely get convinced about these things and they will start using it, because they also use a lot of nano silver particles. They also use nano gold particles in already many things. So when you can use those things, and this is traditionally and customary, they have made these things to a nano level with using the technology of maybe of different nature. So then definitely we should understand and we should accept to open mind to understand these characters and information available in this domain, and it should be made somewhat homogeneous with the world, what the language they understand. So we don't need to worry about why they don't allow it. Of course, time being, there is a restriction due to the constraints of the legal, and each and every country has some its own regulations. So based on that parameters, it is not allowed. Okay, then your best option would be Patola Kaduru Adi Kashaya, Pitta Recha Kwata, almost similar to that. So such type of combinations are there.
Sticking to this heavy metal thing, like I have a wild theory, so please forgive me for this misadventure. It's just like hypothetical. The heavy metal thing is the one which is kind of acting as a barrier. I was reading this How Not to Die by it's a very famous book on on different herbs, largely talks about healthy diet and whatnot. So there he touches on Ayurveda. He knows a lot of knows a lot regarding Indian spices, how they are useful. Even he mentions Ayurveda and all. But ultimately he gives a caveat at the end that I mean, be careful with Ayurveda medicines. They contain heavy metal thing. So the main barrier for this Rasa is to be used worldwide is the heavy metal and its safety aspect. Probably all the industry stakeholders, academic stakeholders with the government of India, probably they should come up with something like a 200 or 300 crore rupees of plan, multi-center clinical trial, especially concentrating on safety and efficacy of this. May not be efficacy just for the safety of it, that it is used for certain weeks in a certain dose would not cause any adverse effect, which is feared very widely by the West. I hope that day comes, sir.
See, basically we need to understand certain things. We should have a rational thinking mind and openness to accept the truth. It may be from anywhere, it may be from the east or from the west. So the first thing is, we all know that any metal in its basal elemental format, how it behaves, the same thing won't happen when in its nanoparticle size. The nanoparticle nanosilver behaves entirely different from the metallic silver. When we accept that in metallurgy and in chemistry, when we are ready to accept this part as a science, a truth, then why don't you accept that Ayurveda has quoted it's a nanoparticle? Because it may be a heavy metal, but remember this heavy metal has been subjected for such a type of Shodhana and Marana procedures wherein it has become Bhasmikarana, and this totally has become a ash which is floating on the surface of the water. Varithara, it has been said. When a heavy metal is able to made or converted into float on the surface of water freely without getting dead immersed into that, it suggests that there is a systematic and on a large scale there is a conversion. So that conversion of a metallic heavy metal into something like a nanoparticle of that metal, definitely that nanoparticle of metal is also having certain typical what you call in chemistry or something like physics, valency, something like that, which attracts certain things, and certain herb chemical is also been combined to that, and it is being triturated with using those of liquids and solvents of such nature. So definitely the outcome of Ayurvedic medicine, whatever it is there in the form of herbo-mineral, may not be the same what the heavy metal they think of it. And Ayurveda never ever said that by we are using a raw material as gold, and by the end of the process we convert it to silver or we convert it into a copper. No, we never say that. It is a bhasma of that particular metal, and ultimately it enters into the bhasma of that particular metal. We are using naga, we are using parada, mercury, but everything will be converted into bhasmas of that particular metal only. We don't change them to different type of things. That's what Ayurveda has said. So then, the modern the parameters of identifying the heavy metal is typical. So that heavy metal has been subjected in such a manner that a test model has been designed. See, we have been designed some model to study the mercury as a metal. Then we have a test designed to find out arsenic. We have a test designed to find out lead. But these tests are designed to identify those metals. And we are not saying that we are converting those metals. We are saying that metals will be subjected to such a reduction, it will come to a nanoparticle size. Still, it remains the same metal. So definitely that metal has to give test positivity when it is subjected for the test. So that's why these what market available tests are there for mercury or arsenic or lead holds good even for the bhasmas of that particular metals. So that bhasmas are definitely will be there, will be giving the results, positive results for the test. But that doesn't make that it is exactly the same of metal element. Elemental in a metallic form may be causing a damage to the body, but it is being subjected to such an activity and such a process wherein it is being reduced to such an ash which starts floating on the surface of water. So such is the beautifulness of this Ayurveda and Rashastra. So we cannot, we need to make them to understand these concepts. And of course, it should be made them to understand in their own metallurgy and that chemistry format and those words. And of course, that requires some multicentric and big people getting involved into this. And of course, in future, definitely they will involve and the things will be in a somewhat better way in the future.
And coming back to Kutki, I mean, we still have a few questions. Does it, being Sheeta Veerya, what, and also it's told as Jwarahara, meaning it is useful in fever. So in fever, we all know that, initially there will be Ama, which gets, which travels through the Rasadhatu and, it causes blockage and fever. So this, this Katuki being Sheeta Veerya, does it, what is its action on Ama generally, sir?
I said, Katuki is one of the drug. It's most of the actions are because of its Tikta Rasa. It is a very potent Rasa, and that Rasa is responsible for many of its actions. So because Tikta Rasa itself is an Amapachika Rasa, then it definitely in case of a Jvara and there is an Ama, it will be subjected for Pachana by this Tikta Rasa. So that's the reason, even though it is a Sheeta Veerya, that Sheeta Veerya don't come in the way of Amapachana, because the strength of Tikta Rasa in Katuki is more stronger than the Sheeta Veerya of Katuki.
It is, like you told, it is a very good herb for liver and all those things are there. And it is also, it tends to clear out, because probably it's told as Vedana, it tends to clear out the gallbladder sludge, meaning the gallbladder contents. They start becoming semi-solid, and they start becoming blocking the channels or gallbladder channels. So there probably it is very useful also, sir.
Definitely, its effect is on basically liver. So liver produces a very good quality of bile because of the influence of this Katuki. Then that bile is collected in the gallbladder. When this gallbladder is being, of course, because it's a Vedana action is also there, this Katuki also acts on the colon. So there will be, it will be helping to the increasing the peristaltic movement. So definitely when the peristaltic movement will increase, then it gives a feedback mechanism to gallbladder, and gallbladder squeezes its content to pour the material into the duodenum. So that's the reason how our system is behaving. It is able to produce quality of bile from the liver, and it is being collected in the gallbladder, and it is being emptied into the gut and thrown away along with the defecation. So this is the entire process. It is under control of this Katuki. So that's the reason when Katuki is used, all these activities can be observed. It improves the liver function, it improves the gallbladder function, it improves the colon function. So in order to get these information, these functions to be done, we need to understand that Katuki has a role in the form of its Tikta Rasa. It is a very bitter principle, and that is one which is responsible for all these actions.
And it is also told to be useful in arshas or hemorrhoids. Probably due to its Vedana action again, sir?
Definitely, when it is making the peristaltic movement more, definitely the mala present in the colon will be pushed forward. So when the mala is pushed forward and mala is thrown, then Then afterwards, of course, constipation is one of the reasons for the arches. That itself will be gone. So there will be no constipation, hence there will be no arches. So indirectly it helps in the arches to get reduction. Of course, and there is another one thing, that whatever the arches which develops in the what you call in the anal region, it is nothing but the engorged or distorted veins. They are connected with the mesenteric veins and indirectly connected with the splenic vein and hepatic vein. So any pressure in have a negative pressure on these things and they become swollen. So that is the reason when these pressures are also reduced in the portal vein as well as the hepatic vein and mesenteric vein, definitely on the rectal veins also the pressure will be reduced. Thereby the swelling won't take place. So in both the direction it will be helpful, and that's the reason even it is good for the arches.
Yeah, and the the Nigantus explain Katuki to be useful in like Shwasa Kasa, meaning cough, cold, bronchitis, or disorders wherein breathing is made difficult due to the disease. And it's also seen that Histatin, a very famous proprietary Ayurvedic medicine in India, they use Kutki as an ingredient. So I mean, despite the Sheeta veerya, I mean, you have already clarified about its Sheeta veerya, but despite being cold, it's also very frequently useful in Shwasa Kasa and even in the allergic respiratory tract conditions as well.
See here, Katuki's action of Pichrorhiza is taken into consideration, and Sheeta veerya doesn't come in the way of these actions. So that's why we don't want to get carried away by the misconception or right that Sheeta veerya is there, Sheeta veerya is there. You keep aside the Sheeta veerya. Katuki Sheeta veerya doesn't come in the way of action of the Katuki. Many of the Katuki's action is due to its Pichrorhiza. So here Pichrorhiza is stimulating the liver in such a manner, it is clearing the tract of the bile as well as it is also expelling the most of the coast and clearing the conditions. So a drug which is clearing the liver and as well as clearing the gallbladder, clearing the colon, definitely will have a very good effect on urticaria or any allergic disorders. Probably because of that reason, the Histatin, they have added this drug into their combination. So it is indirectly helping the urticaria or the Sheeta Pitta condition type of thing. The allergic manifestations could be reduced or can be cleared by the way of cleansing the colon and even improving the liver function. When liver function is improved and colon cleansing is done, automatically the itching part and all these allergic manifestations will be out of range.
And like, what side effects should we keep in mind while we are Kutki, maybe in higher dose or for a longer period of time?
Only thing is higher doses, it may some sort of watery motions or purgations, or in certain patient it may cause some gripping pain. These two things to be kept in mind. Otherwise, nothing to worry.
What are your favorite medicines containing Kutki that you use on a regular basis, sir? I'm sure that you have, I mean, you are an advisor for Pentacare, and Pentacare has a Kutki capsule.
Yes, we have a Kutki Churna is there. We have a Katuki tablet is there, and we have a Patola Katurohinia, the Kashayam is there. Vata is there, and we have one capsule called Immunup. It also contains Katuki. So there are plenty of combinations are there, and of course Arogyavardhini is one of my favorite drug, which contains a lot of Katuki in it. And of course, even I use one drug Amrita Bhumi. It is also containing Katuki.
Whenever we talk about, say, Ashwagandha, so it's Balavardhana, immunomodulator, immunoboosting. So we tend to keep certain herbs in certain baskets. So Bala is there, so Shirvara Thaila, Narvine tonic and all. But this Katuki is almost like spread across widely. Like it's there in fever, Shwasakasa, Arsha, Vedana, liver. So it addresses many organs and many systems at a time.
But we need to understand, we can't simply give Katuki in every jwara. Just like how pan jwara is there, we can use Ruchi. Similarly, we don't use Katuki. We use Katuki in a very peculiarly where there is ama and where there is a very clearly which is related with the where we feel that it is from the liver and gallbladder, or it is associated with Agnyashaya or Pitta Pradesha, or even from the upper portion of the colon. If these areas are involved and Jwara is manifested because of the disturbance at the doshic disturbance at these levels, then Kutki is used in that condition. It's not simply that we have a headache and cold body ache and Jwara, it is there. In that condition, we don't use Kutki. We have better drug in that basis, like Ma Sudarshana Kada is there, Ma Sudarshana Vati is there, or even Tribhuna Kirti is there. So that area, that disease, that condition is entirely different, and accordingly we use in different drugs for that condition. Katuki is very specifically we use it where we file it. Katuki, for example, pancreatitis, cholecystitis, hepatitis, or any duodenal things. We will feel that Jwara, which is due to some infection in the colon, enteritis. In these conditions, if liver is involved, or we can say that it is yakrit, pleha, and these type of organs are involved, then it is better to select Katuki over there. So we need to be very specific in selecting, because there are certain drugs which are very much target oriented and tissue oriented are there. We need to use them accordingly.
Yeah, so let's a little bit move to the other aspects. I mean, a question has come here. It's a never-ending debate in Ayurveda versus modern approach. Can we please discuss how extracts are different from whole herb? To give a context, Ayurveda do not just use curcumin, and it uses turmeric as a whole, like we use turmeric powder. So the level of extracts that Ayurveda uses is, say, water extract, as in case of kashaya. We boil the herbs in kashaya, and we boil the herbs in water, filter it and use it. Or a generalized mass extract extracted through the ghees and oils, like as in case of herbal ghee and herbal oil, where we boil the decoction and the herbs along with the ghee or oil, so that there is some extraction going on. In Asava and Arista, alcohol is used as a medium to extract a little bit. So these are all like not specific chemical extracts, and these are like general extracts that we do. So overall, Ayurveda believes in the whole use of whole herb. And I also came across an interesting thing, that curcumin, and it's an antioxidant effect. It's effect on many different things. So all the effects of so there was a study conducted with curcumin and turmeric minus curcumin. So whatever the uses that curcumin contains, even there are some other chemicals in the turmeric which have the effect of curcumin itself. So if you are using curcumin alone, we'll be missing that non-curcumin turmeric other ingredients. So we'll be missing that chemicals. So Ayurveda strongly believes on using the whole of the herb, rather than it almost discourages using singling out a particular extract and using it. Your comments on that, sir, please.
Definitely, we need to use a whole drug, because Ayurveda, whatever the Nigantus and everywhere they mention, so many actions for a drug has been given credit, and that credit goes to a drug as a whole. And because in some of the actions are brought about by the Rasa, some of the actions are brought about by veerya, some of them are from guna, from due to vipaka, and some of them are due to prabhava, something like that. So every component inside the dravya will be responsible for one or the other action of the drug, and whenever we use a drug as a whole, we anticipate that all those lakshanas, all those actions could be seen in the body. But instead of that, instead of Haridra, if you are using curcumin and expecting that all the actions of Haridra will be taken care of, no, that is not possible. If you are using allyl disulfide and thinking that you will get all the effect of Lashuna, no, it is not like that. If you are using the piperine and expecting all the effect of Pipali, no such things are there. If you use a whole drug, then all the other actions are also be manifested. If there is a provision inside, when you are in a patient in whom you are giving it, if that action could be manifested, there is a prerequisite condition which is giving a particular doshic imbalance where this drug can act, then only the drug action can be seen. But provided that there should be something which is supportive to that. On the contrary, whenever we have seen in a drug as a whole, many chemicals will be there and they interacting with the other, and in some homeostasis they remain. Even though certain actions they'll produce and certain actions they won't produce, even though they are capable of producing it, because by the influence of the other factor present in the dravya. But when you give a curcumin or something like the extracted material or single molecule extracted from the dravya, then it may have an advanced or enhanced action. Sometimes that may be even dangerous. It may cause even damage to the organs. So that is not a required one. That's the reason Ayurveda has very clearly said it has to be used the way it has been explained in Ayurveda. And we have something called water soluble extractives, that is in the form of kashayas. We have some lipid soluble extractive, that is in the form of oil and ghee, and we have some alcohol soluble extractive, that is in the form of Ashwagandha. So these are the basic methodology that even the depending upon type of the solvents they are used, and accordingly Ayurveda has developed these things in a very safe manner. So it has to be accepted and it has to be used in the same manner. It has to be, or it is intended to be, not be distorted with any other methodology or the methods to make it something and abnormal one and later claim it is Ayurveda, though it is not right.
Thank you there, sir. And another question is there that while using the herbs which cause liver cleansing, such as Kutki, it changes the bowel movement, and initially there will be increased bowel movements. Will that have an effect on the color of the stool as well?
Definitely it will be. See, once there is increased bowel movement, definitely the color of the stools will become lighter or even yellowish, normal. And of course, the stool color depends on various factors, the material what we are eating, and of course, the medicines which are taking, other that type of things. For example, if any iron containing pills you are taking along with these things, then the color of the stools may change to brownish, blackish. So that depends. So what type of things are been there? Of course, that doesn't mean any change in the color. I mean, it's not a big issue that the color change will going to cause any bad effect on the our body. Usually, where there is a problem with the liver, stool color will be somewhat hampered. But once Kutki and such type of drugs are given, they cleanse the liver as well as they detoxify the liver and they cleanse the bowels. Definitely, the color will be in the earlier portion will be dark brownish, later it turns to yellowish and greenish. So that is the reason it improves the bile output. Definitely, the color will also be enhanced.
Thank you, sir. Next question is regarding alcohol addiction. Does Ayurveda have any treatment for alcoholic addiction? Rajasthan Aushadhalaya has a Surari Churna with Vidarikanda, Soya, Jyotishmati, Trifala. Please share your thoughts on this, or if there are any better herbs or treatments specifically targeting alcohol addiction.
See, all these de-addiction things are there. There are, of course, there are certain drugs has been explained, but simply taking those drugs will won't give you the result outcome. De-addiction is also a process wherein a lot of counseling is required. So usually along with these drugs, counseling is also a must. Otherwise, then it won't give you simply just you take a medicine and the person will from tomorrow onwards he won't consume the alcohol. No, no such things will happen. He needs to be isolated. He needs to be given counseling. He needs to be made in such a way that he doesn't get the alcohol in time. All these things is to taken care, and of course for the outcome of these will be that you will have some withdrawal symptoms and some problems will be there. To overcome that, we need to have a complementation or a supplementation from the some medicinal part of things, and of course the liver will be somewhat damaged with the alcohol consumption, and that needs to be corrected, and all those areas to be taken care of. So it doesn't mean that simply by giving some medicine we can come across. I mean, we can come out with the good colors that the de-addiction will not take place. De-addiction is a big process wherein a lot of counseling is required, and patients should be kept in isolation, and things should be settled down in such a manner that he should not get the alcohol. So all these things will be there. Then there will be a lot of mental disturbances. We need to give some Medya Rasayanas also along with that. So all these to be kept in mind.
Also, I was just about to ask about Medhya herbs, and you already touched that. A lot of conviction and convincing and conviction is required on the part of the patient there, and also nervine tonics are also required. I mean, I have seen, like, I mean, I was working as a junior doctor in a psychiatric nursing home. When they start it, they will be like literally almost like they'll be unconscious, like for initial 2 3 days. I mean, unconscious is not the right word, but they'll be confused. They'll be even craving will be so much that there will be lot of shivering. They'll not be having control over bladder, and they'll be like going and searching in the corners of the room for sura. So even nerve tonics will also help there, sir.
Definitely, that's what I said. Even Ashwagandha will do wonders. Vidari will be useful, and even the Medya Rasayanas like Brahmi will be useful. Shankapushpi will be useful. Vacha will be useful. So all these drugs can be used as per the need, and of course, along with that, a lot of counseling is required, and repeated counseling is required. And patient is kept in isolation, and time is very much important in that. For a period of time, if the patient is unable to get the alcohol, then bodily whatever the withdrawal symptoms are there, then slowly they pay off, and then the person will be in right direction. So it's not just simply by giving some medicine, de-addiction won't take place. It requires a lot of approach.
Nerve pain, like if someone has nerve pain, what are the measures to take, or how to approach it, sir?
See, we need to understand which nerve pain, what is the area that has to be taken care of. First, if you get the information, for example, if a pain is from the sciatic nerve, then accordingly we can select a drug. If it is from post-herpetic neuralgia, it may be in the back of the upper back or even the chest. If it is due to peripheral neuropathy, in case of diabetes, long-standing diabetes. So like this, we understand pinpointedly which nerve or which part, then accordingly we can select the best combinations for that. But of course, there are certain drugs which are generalized as a nervine tonic, or it can be used in all neuropathies and nerve pains and certain neuralgia conditions. So that can be used all over. But if any specific is there, area is there, then we can pinpointedly concentrate on what exactly drugs can be selected. For example, if case of sciatica or lower backache and pain radiating to the lower limbs, then we use Nirgundi Grutha or low back ghee or spine act or Rasna Erandadi Kashaya or Sahacharadi Kashaya. So it's like this, very specifically we can target the areas. So we need to get that information from the history of the patient, then that will be good.
Yeah, next is quite an interesting question. How can we balance the hot or cold potency of a herb without sacrificing its benefits? For example, if ashwagandha is too hot for a patient who is taking it for anxiety purposes, what can be given along with ashwagandha to reduce its hot effect on the body?
See, ashwagandha is such a drug which is katu, ushna in nature, where definitely its ushnatha will has some predominancy. So if ushnatha of ashwagandha is going to cause me a trouble, then I have a special target. Acharyas have given ideas how to do it. We'll go for kshirapaka. We go for ashwagandha kshirapaka, and that ashwagandha kshirapaka will definitely, that snigdhata of the dugdha or the milk will definitely will reduce its ushnatha, tikshnatha of ashwagandha, and thereby it's a bad effect produced out of the ushnatha and tikshnatha of the ashwagandha will be covered by snigdhata and madhurata of the dugdha or the kshira.
Even like herbal ghees, like ashwagandha grita is there. So grita balances vata and pitta. Probably that is also useful, sir.
That can also be done. But preparing a grita, it takes much longer time when compared to simply boiling with dugdha. Simply boiling with the dugdha, it can be very easily done even at the patient level. But preparing a grita means it once again require a skillful person, and doctor should do it or something like that. So that depends. What is your client ability to handle the thing? Whether he insists on preparing by himself or he wants to just you give something. So that depends on all these criteria. Of course, definitely we have ashwagandha grita is also one of the thing which can suppress the ushnata of the grita. I mean ashwagandha.
Next question is, please address nicotine addiction, especially in young teens through electronic cigarettes called as Juul. It's a Western phenomenon, especially in the US. They have this electronic cigarette and it's famous as Juul. I thought it was banned. Banned for teens especially, and other electronic apparatus for nicotine. It's a pandemic that I see every day now. Any herbs, any treatments for nicotine addiction, quickly, sir?
It may be nicotine addiction, it may be alcohol addiction, whatever it may be addiction. In that case, one person is getting easily get addicted to that, means his medhya has to be taken care of. His being should be subjected for a lot of counseling and needs to be given medhya rasayanas, and we need to isolate him and avoid him that he should not get it, and the time should pass. Maybe like if we could able to achieve that the isolation without any such things for 1 month time, then definitely automatically that cravings for those things will reduce, and the person can be easily brought out of that addiction. So otherwise, simply by giving some medicine, de-addiction won't happen.
Yeah, I mean, we are talking about addiction, and recently, and it's a little bit unrelated. Facebook, one of the Facebook employees has come out and said that Facebook and Instagram especially has been designed so that teens get addicted. I mean, there are a lot of research. I mean, they put a lot of research. I mean, Facebook hires a lot of neuroscientists, PhDs in who specialize in neurology, psychology, etc. The argument there is that the whole of the social media, Facebook and Instagram in this instance, because there's a hearing going on and a lot of TV shows, everything, the debate is on that. But social media as a whole is designed to keep everyone addicted to it, especially the teens and all. And what is the solution for it and all? And there is also counter argument that I mean, a product is ultimately Facebook is a product, and they want anybody would want to sell his product more, so also is Facebook. So nowadays, especially to the teens and all those people who feel addiction towards anything, a lot of media herbs are required. Even like people need to concentrate on their brain control, their habits, sort of dinacharya, and what they are getting addicted to. Kind of self-analysis is the need of the day for the whole world. Sir.
See, first of all, we need to convince that patient. When the patient comes to us, whether he is been coming to us independently or by parents or something, he has been brought to us. If he has been brought to us, then the one who has brought him, he will be telling the complaints. Sir, my son is doing like this, my daughter is doing like this, like that. Whether the daughter or son, they themselves admit that, yes, I am getting addicted to this, I want to come out of this. If such things are there, then it is easier. If he himself has realized it is going to cause problem to him and he is in trouble and he needs some support, then it will be easy for him convince and counsel and give medicine, and it can be. If it is he is feeling that I am fine, doctor, but my mother is saying that I am addicted, I don't find that I am addicted, I am quite normal, I am using only few hours in a day, I am not addicted, that he himself is feeling that he is not addicted, then in such a manner, then giving a counseling and giving a medicine doesn't work much. So that is a area where we need to be. Whether the patient has been brought to us with complaint or patient himself has come to us with the, that is a very important thing. And then it will be easier for us to go for a counseling and a medicine and all those things. Of course, provided along with this, we need to inculcate different thought process in them, that we need to just sow a seed related with meditation, pranayama, self-healing, and all these concepts into their mind and create a new centers of stimulation. Definitely they will also produce some waves, and that will bring about different vibrations in them, and definitely that will come. Of course, it won't come in one day or one sitting. Multiple sittings are required.
Yes, sir. And there's a question on Katuki. Dr. Vijayalakshmi ji asks, Katuki it balances kapha and pitta dosha, but it is Ruksha. It's told even in Nigantus. So because of its Ruksha nature, how to administer Katuki in a Vata Prakriti person?
See, that's what we need to not give too much of importance to each and every fine point. Only if it is difficult in handling it. Because if you observe there, acharyas with these qualities, it is being told, and afterwards only they said this drug is going to use in these particular conditions, and this drug works in this fashion. So with these Lakshya, Rukshata, Katuvipaka, Tikta Rasa and Sheeta veerya, with all these combination, then also it is behaving in this fashion. That we need to understand that. Here, if a drug is Ruksha, it doesn't mean that it is only going to increase the Vata. It is not like that. We don't should not understand in that sense. That's what I said. In case of Katuki, Katuki is a very, very strong drug which acts through its rasa. Here, its rasa itself is its veerya actually. And this particularly Katuki, Sheeta veerya doesn't come in the way of its Pitharechana action. Pitharechana action, it won't come in the way. Similarly, it won't come in the way of Deepana action. Similarly, its Rukshata doesn't cause any problem if it is given to even Vata, Prakriti Purusha. See, Prakriti of a person is just an idea, gives us that what type of drug should be selected and how long it should be taken or where we need to stop it. It doesn't mean that a Vata Purusha, Vata Prakriti person will not get a Pittaja Vikara. Even he too can the Vikara or even Kafaja Vikara. So like that. So it doesn't mean that Prakriti of a person is not only simply influencing all the diseases. It is said that if a particular Prakriti person is there, if he gets a similar type of his Prakriti involved doshas are also involved, means same type of doshas, the same Prakriti and same time of the day or even the season of the year, then whatever the disease manifests is a stronger one. That's what they have said. Is Eka Doshaja, something like that. It is Sukasadhya. Easily it can be curable. So all these concepts are also there. So we don't want to just to scratch our head for just simply saying it is a Ruksha. How can we give it in Vata? No, don't get carried away by such doubts. It is very clear with these combination with all these Rasaguna Virya only the Acharyas have quoted that this drug works in this fashion. So when the Acharyas have given the Aptopadesha, this drug works in this fashion. Let us use it without any hesitation.
A participant has asked whether Guraja sir is available for consultation over Zoom. He uses Google Meet or Zoom is also fine. Yes, he is available. I just typed in the chat regarding his consultation details. easyayurveda.com/Gururaja. Of course, if you are from Karnataka, you can directly come to his clinic. If you are from outside India, please use that link. All the details of his consultation is there. Next, can Kutki, Guduchi, Kalamega, Bhumyamalaki, Punarnava, all these can be used together, sir?
Definitely. Already there are so many drugs in such combinations in the market available.
Could you guide for treating a patient with extremely dry, stretched, cracked palms? So dry, stretched, cracked palms as well as feet, plantar and dorsal, which occasionally tends to bleed.
So by this simple information, because I don't know the total history of the patient, just because of these simple presenting complaint, I can feel that it may be taken in the category of Vipadika, a disease in Ayurveda, or it can, if it is further evaluated, it may be plantopalmar keratosis or plantopalmar psoriasis. So we need to diagnose it first, then accordingly treatment definitely can be done. It may be Vipadika or it may be plantopalmar keratosis, that type of condition. It looks like if they send the photos, then we can finalize to some extent. Of course, with a little bit of more history required, since how long it has been the person is and in what season it will worsen and how it will be, it's going on, and in the family history supporting any factor is there. So such type of informations are required.
Luhase, ma'am, if you have any question, please.
Yes, namaste. I wanted to ask if the person has a mild goiter or swelling of the thyroid and the mildly hyperactive thyroid. I tried with Kanchara Gugulo, and it didn't went further, but it didn't also completely remove it. It's Pitta Vata Prakriti person. and you can see some pitta qualities in Udana. And Apana is also aggravated with Vata qualities, some Sleshaka there, some Sadaka. But this, I tried also Kaishara Gugulu, but she's very sensitive. It's about 40 years old lady. She's very sensitive to any peppers like pipali or something. And so this didn't suit for her. She felt there was some inflammation. Is there anything else besides Kanchara Gugulu one can do in case of the mild swelling of thyroid gland and hyperactive thyroid?
We have one preparation called Hamsa Patyadi Kashaya. I don't know whether it is available online for you there. You just try it out. Hamsa Patyadi Kashaya. That is also one of the combination. Then other than that, Gomutra Haritaki is also there. If it is able to, for you, that Gomutra Haritaki, it is available in the form of capsules that can also be used in case of thyroid disorders.
Very good. Thank you so much, Vaidaji. I will try that. I had also tried with her to give her a Kuduchi Kashaya, and that also like helped a little bit, but same time the swelling is or the quite enlargement of a thyroid gland is still there.
We need to analyze it, whether this is a simple goiter or whether it is a colloidal goiter, whether it is a Galaganda or a Gandamala, like that we need to understand it first. Then accordingly we can go for drug selection. So, but in all the things like thyroiditis or even Graves' disease or anything like that, long-term therapy is required. And of course, if it is a mild swelling or even it's a very prominently you can see the swelling in the thyroid gland, then definitely it may be a colloidal goiter or it may be a simple goiter, maybe even hypothyroidism with a goiter. So then in those conditions, better we can select a combination of drugs such as Hamsapatyadi Kashaya, Kanchanara Gugulu, as well as even Gomutra Haritaki capsule.
Very good, Vaidaji. Okay. I will try and see what the results is. Thank you so much for guidance.
So thank you everyone for active participation and interesting questions. And special thanks to Dr. Gururaja sir for answering all our questions patiently. Thank you so much, sir.
Thank you, one and all.
Yeah. Thank you all. See you in the next Gurubodha session next Sunday, 7 p.m. Namaste to all. Goodbye.